Hi everyone. Sorry, I was having some technical difficulties, as we all are these days. All right, so we'll wait another minute or three to see if anyone else logs on, and then we'll get started. All right, so I'm just going to take attendance, and then we'll go ahead and get started. Okie dokie. So today we are going to start talking about development. And those of you who do download the notes have looked and see that this is a very long chapter, which is why we have 2 weeks to talk about everything. This is a section that is divided into actually 5 classes in our curriculum. So that's one of the reasons why it's so long. So there's a lifespan development class you can take that will be a more in-depth version of what we're going to do over the next 2 weeks, which is cover basically in utero to death. Then we have an infant development, a child development, an adolescent development, and a adult development and aging class. And those are all taught by Dr. Martireau, who is our development psychologist on staff. So if you are interested in development in general, or if you're interested in one of those areas of development in particular, highly recommend you take classes with her. She actually writes the textbooks for a lot of her classes, which is really cool. And then some of them she actually, I think maybe Child, she has videos of her girls when they were little. And they were actually part of the textbook material, which is really cool. So just a little plug. If this chapter really sort of sparks your interest, definitely look into taking those developmental classes with Dr. Martireau. Again, just to give you an overview thumbnail sketch of the what's coming up. The next 2 weeks before Thanksgiving, we're going to cover the development chapter and do our review. When you get back from Thanksgiving, you will have exam 3. So you have that whole week to eat and enjoy, and then, you know, like the last couple days, do some studying and you'll be all right. And then we'll have a big review discussion day, and then you'll have a cumulative final. So we are really close to the end of the semester now, about 4 weeks left of really 3 weeks of time we'll see each other and then our final. So we're getting there, y'all. So be looking over things like Connect assignments. At Thanksgiving, I'll go through and start putting in zeros for anything that's not done. Be looking at things like those participation or the psychology experience credits. Making sure you're getting all those little things checked off so you're not trying to jam them all in at the very end of the semester when you have a bunch of stuff to do for all your other classes as well. All right, any questions about logistics for anything coming up?
Just one. Is for that final, is it going to be like a multiple choice or like an essay?
It's going to be an extended remix of what you get normally. So more multiple choice, more true false, more fill in the blank, all that good stuff. Good question. Alrighty, well, I'm gonna go ahead and share screen, if I can talk, share screen. Alrighty, so here is our very cheerful PowerPoint. This is, I think, one of the first classes I prepped after I got here, and I was like very enthusiastic about always getting the correct PowerPoints with everything. So, hang on, I'm getting a spam call, so I'm just gonna send that to voicemail. There we go. Keep for my remote. I knew I had it, and it was blending in with my laptop. So I'm going to stand on up here and get us going on development. So we're going to talk about developmental transitions. So thinking about development across the lifespan, but a lot of what we'll talk about is child development, just because I think that's what people are most interested in. But certainly developmental psychologists study things across the lifespan. And honestly, the area of development that is going to have the best job growth coming up is aging, because all the baby boomers are aging. And so they will actually need a lot of care. So things like gerontology, things along that line will be really necessary coming up. So this is the study of human development, and it's organized into different distinct periods. And these kind of match up with those classes I talked about. So we don't have a class strictly about prenatal development. It kind of gets rolled into infancy. But then there's childhood, adolescence, and adulthood. And again, adulthood goes into aging as well. So really, lifespan development is defined as the changes that occur in people as they age from conception until death. And it really involves growth, but then also decline. And people kind of miss that piece of it sometimes. And it's the product of several processes that are intricately intertwined. So physical processes like biological maturation, we go through certain stages through childhood, obviously big changes in adolescence, but we also have physical changes as we age as well. Cognitive includes changes in thinking, changing in language. Intelligence stays fairly stable, but as your memory might start to suffer, your intelligence scores might not be as reflective as your abilities. And then obviously psychosocial differences. So this is both emotional and sociocultural differences. So as a kid, you have to learn how to socialize, right? You gotta kind of get yourself together that way. How do I share, right? How do I learn to do things like that? And then as you age, you might have changes in relationships, in your emotions, and how you react to other people that are really going to influence you. You know, it's morbid to say, but you know, if all your close friends start passing away, right, then you lose that support network. All right, but we're going to start by talking about prenatal development pretty briefly, just because we don't know that much about the psychology of a fetus. It's not something we've ever really studied, other than their brain development. So there are 3 phases of prenatal development, and this is where I think a lot of people in our society get confused. Okay, that there's not just like you're immediately growing a full-grown baby in there, right? So the first 2 weeks is called the germinal stage. So you have conception, and what forms is called a zygote, and I'll throw that in the chat for you. So you have the term spelled out. And a zygote is a one-celled organism formed from the union of a sperm cell and an egg cell. So if you remember way back to when you learned sex ed or maybe biology and, basic cell bio, each of the sperm and the egg, right, only have half of the DNA information of the parent. So that when they combine, it makes one full set of all of the chromosomes, right? So it starts out as just one cell. And then if everything goes right, it implants on the uterine wall. There are a lot of times the zygote just doesn't implant for whatever reason, or maybe the sperm and the egg just aren't compatible genetically, and the woman would have never known there was any kind of conception that went on, has no idea that her period is any different than any other time. And then there is the formation of the placenta that begins at this point. And if you're not familiar with what the placenta is, this allows oxygen and nutrients to pass to the developing organism throughout prenatal development. So it's important that that be formed pretty early on. Again, problems can go wrong here. I don't know how many of you might follow Chrissy Teigen or John Legend on social media, but very tragically, they just lost a pregnancy like the 4th or 5th month, which is really, really hard because you essentially have to give birth at that point because her placenta was in such a location that it was hard to maintain. Honestly, at that point, it's hard to keep the fetus in, and it's also hard to like keep the nutrients going. But again, a lot of things can go wrong at this stage again, and again, the woman would never know she was pregnant, right? It just might not implant, might not form properly, things can happen. I believe like 1 in 3 or 1 in 4 pregnancies ends in some sort of termination in terms of something going wrong before it even implants, miscarriage, or what we call a stillbirth, which is when, like Chrissy Teigen, you have to essentially give birth and the fetus isn't going to survive. So once you get past that stage of the zygote, then you reach the embryonic stage. So it's an embryo until 2 months have passed. And during this point, you have formation of the vital organs and systems, the heart, the spine, the brain. And it's, again, a time of vulnerability. It's very problematic if anything interferes with development. And this is really hard because this is another stage where you can have miscarriages, where, again, if there's just something wrong genetically, it just won't be viable, where the heartbeat might no longer be there, even though it was there at the last doctor's appointment. Or you might just lose it and not realize it was going to end that way, right? So this is, again, can be a really tough time. And then the really interesting thing, now it's so funny because I think the last time I taught this class was before I had my child. And having now gone through this whole process, so they actually count your pregnancy from the date of your last menstrual period. So technically, when I was 2 weeks along, the medical profession counts it as 4 weeks along, just because they don't know the exact date you conceived. But they do know the last time you had your period. So for that reason, even though it's technically 38 weeks, pregnancies are counted as 40 weeks because it includes those first 2 weeks where you're not actually pregnant. So things I can add now that I've known this whole system. It's so funny because I was really open about talking about this stuff because I found it so fascinating. And one of my friends who's a geologist was like, wait, what? They count it then? It's 40 weeks? I was like, I know, right? So, wrinkles in your brain if we go with that old idea. That's not actually how any of this works. But so that's the embryonic stage. It is not a fetus yet. It looks like this thing down here. Okay, so this is the zygote. This is an embryo. An embryo is really just kind of a blob with a heartbeat. Okay, not viable in any way, shape, or form. And then you get to the fetal stage, and this starts at about 8 weeks and then goes to birth. Body growth continues here for the fetus. They start to move around closer to the middle of the second trimester. You'll start to feel some movement. The brain really starts to grow at this point. Brain cells are multiplying. The age of viability might be somewhere between 22 and 26 weeks. That's really up in the air. Even with all the medical technology we have at this point, it doesn't mean that every baby at that point, once you're out, it's a baby. Once it's still in, it's a fetus, right? That is delivered then can survive it. Particularly at the low end of that, so 22, 23, even 24 weeks, the chances of survival are pretty slim. At 26 to 28 weeks, chances improve to survival rate of about 85%. But again, remember, you're technically supposed to get to 40, right? So that is 12 weeks, even at the high end of that, right? Or you're not getting the development you would typically get in utero. And this is why NICUs, or neonatal intensive care units, keep them in sort of incubators. It's supposed to, as close as possible, replicate what the environment would be like if they were still in utero. And then this picture is actually a 3D ultrasound of my cousin's baby, who I think just turned 13. So that's an old one. So yes, Caitlin, yeah, that's really common. If you're born early, you're gonna stay in the hospital. I even had a friend who delivered 6 weeks early, so at like 34 weeks, and her baby had to stay in a month after she was born. So yeah, they really want to make sure that that child can actually live on their own before they release them. They also want to make sure of things like try to minimize their exposure to germs, right? Because they don't have a lot of the same benefits that they have if they get to full term. So once you get to like 36 weeks, anywhere within that month of when you're due, it's typically considered, you're in pretty good shape. I say a friend that had the baby 6 weeks early, had her first baby 4 weeks early. The two of us just kind of joke. She's really petite, like a couple inches shorter than me, and I'm not very tall, and also just teeny. And we like kind of jokingly agree that like her body just can't cook them any longer because she's so small. And her first baby went home with her like a normal baby. So, those 2 weeks even can make a difference. So sure, at 24 weeks, staying in that extra time, definitely. And again, sadly, even at, 24, 30 weeks, there are times that they just can't save the child. And, unfortunately, that is nature, right? And it's hard to say that, and it's devastating for the adults. But there are just times where there was some biological, often genetic reason that fetus wouldn't have been able to survive as a baby. All right, so this gives you a nice indication of how the development takes place. Okay, so again, this is like blown up of what a zygote looks like. But it's teeny tiny, head of the pin type stuff. It really does take until about, 19 weeks till you start to look at it all like a human, right? Like even this is not very humanoid per se, right? So if any of you have driven by, right, the Planned Parenthood on Newtown Road and seen their horrific images of supposedly aborted fetuses, they're not accurate because all abortions sort of happen in actually this phase. So certainly make sure you research because again, it's not always accurate. Here's more of an illustration of it. So again, here they're showing about 38 weeks full term. And again, that's if you take the 2 weeks off that you're not actually pregnant, but they just count from your period. And so you can see, again, it takes quite some time to fully develop. And the babies are often fairly sizable when they come out. I mean, my baby was in the 7-pound range, but there are babies who are born who are like 12 pounds already. And I feel for those mothers. That's got to be tough. But I kind of like this chart because it shows, what forms when, right? So, like, here's where you might start to feel movement. Here's where you might be able to have hiccups. They start to get body fat, they have increase in weight. And again, see here, like 36 weeks, they're getting that immunity from the mother. So again, if you're born much sooner, they have to give you a lot more protection. And then again, technically 38 weeks or 40 weeks if we're counting from the last period is full term. But again, anywhere in this range, you're probably going to be okay. They actually induced me a week before I was due because I unfortunately developed gestational diabetes and gestational hypertension. I was able to mostly manage them with diet and exercise, but it was safer for me. It was safer for my child to do a week early, which was fine. Alrighty, so one of the things that we look at as psychologists is environmental factors, and these really can influence prenatal development. So maternal nutrition is not one we think a lot about, but malnutrition is linked to an increase in birth complications, neurological problems, and psychopathology. So the child is being more at risk to develop something like depression and anxiety later in life. And even moderate maternal malnutrition has effects for years afterwards. And it might be linked to even those psychiatric disorders appearing as late as adolescence or early adulthood. So again, not something we typically think about, but very important. Again, I think I've told you all before, my area of specialty is eating disorders, and people can get eating disorders while they're pregnant. And that's really scary because you put yourself at all these risks, right? But obviously, if you have that pathology, it's really hard to see yourself getting bigger and bigger, right? When you've been sort of trained to think that that's a horrible thing by our society. Maternal drug use, also obviously problematic. Tobacco, alcohol, prescription, recreational drugs, even some over-the-counter drugs can cause birth defects. So like basically when they're pregnant, they say before you take anything, check in with us. You can't take like most cold medicines, for example. There are all kinds of things. I think there was one of my medication for my irritable bowel syndrome I couldn't take because it's linked to birth defects, or they just don't know. And depending on your doctor, they may be more or less stringent. So like my OBs were like, yeah, these are all okay except this one. My ear, nose, and throat guy tried to be like, you should get off all your allergy meds. And I was like, I won't survive. And I was like, you know what, I'm going to defer to the OBs on this. They know what they're doing, right? This is their area of specialty. And then fetal alcohol syndrome, and you may have heard of this one. It is one of the leading causes of developmental delay, what we used to call mental retardation, but we tend not to use that term anymore because of the fact that it's become derogatory. And it's a collection of birth defects. So they're congenital, they're inborn problems associated with excessive alcohol use during pregnancy. It can include things like heart problems, microencephaly, irritability, hyperactivity, so like symptoms of ADHD, and delayed mental and motor development. And it's related to an increased risk of depression, suicide, and criminal behavior in adulthood. Although it's not clear that that's a one-to-one or if that's because of the, rejection they might face because of, being developmentally delayed. There are physical differences, things like that. There are lots of kids who don't meet the criteria for a diagnosis of FAS, fetal alcohol syndrome, but are still impaired due to their mother's drinking. So this is really controversial, and again, like something I didn't know about before I got pregnant myself. So most countries in Europe, women drink throughout their pregnancy, not excessively, but they might have a glass of wine a day or something like that. Here in the US, we're told not to drink at all. And like the research is really mixed, and there's also not a lot of great research, right? Because not a lot of people want to be like, well, let's try making pregnant women drunk and see what happens. So, I erred on the side of not drinking at all, but I knew friends who drank, a glass of wine a week, and their babies turned out fine. So, it's definitely something you would have to decide with your medical provider, and hopefully, we'll just keep getting more and more knowledge that will inform us better. And, again, things we have to be sort of aware of are, deficits in IQ, reaction time, motor skills, attention span, and even math skills specifically. And again, possible impulsive hyperactivity, antisocial behavior, delinquent behavior. And here are what some of those physical symptoms look like. You can see some changes around the eyes, ear abnormalities, nose differences, things like that. So in terms of the cognitive symptoms, we think about everything we've just learned about, memory, intelligence, that type of stuff. We do see low IQ here, poor impulse control, poor judgment and decision-making, which means some impairment in executive functioning. Language delays, so they might start speaking much later. And hyperactivity. And it often contributes to problems with the law, problems in your schooling, and difficulties with independent living. So some of these folks, if their FAS is severe enough, will end up to where they can never live independently, essentially. They'll always have to have some sort of caregiver. And it's difficult to diagnose conclusively unless we can get a straight answer from, the person carrying the fetus. Yes, I drink, right? Or I'll give you an example. I never followed up with this woman, so I don't know what happened. But when I was in grad school and I was doing rounds in the hospital, my supervisor loved to make us figure stuff out for ourselves. And so he just gave me a room number one time. And he's like, come to this room. And it was the maternity ward. So I had to get buzzed in, tell them who I was, because they're very careful. They don't want any babies stolen. Even though I don't actually think that happens that often. But he was in the maternity ward with a woman who I think was in her second trimester of pregnancy and was drinking a 12-pack a day. It was really, really sad. She was standing using an IV rod to keep herself up. Again, I never followed up, but I would imagine that child would unfortunately suffer from FAS. There are other things that sometimes we can't control that can affect us as well. Some of these we can, right? So things like rubella, mumps, even influenza, right? We do have vaccines for those now. So maternal illness in general can interfere with prenatal development, and the nature of the damage depends in part on when in the pregnancy the mother contracts the illness, which illness it is. Really interesting thing that I learned while I was on my residency is one of the things I did on one rotation was work in an HIV/AIDS clinic one morning a week. And there's actually a woman there, a doctor there, who specialized in prenatal issues. And if you are careful, you can have a child whose mother has HIV/AIDS who is born without it. And that's because for some reason, it's not transmitted via the placenta. Something about the placenta is able to protect the child. So most cases where the child is born with AIDS or with HIV, that's the precursor to AIDS, is during some sort of trauma during birth. So, the child's trying to get out and cuts themselves on the mom's hip bone, and the mom has some sort of tearing, and it's transmitted that way. So this doctor would make sure, she would call me when you go into labor, make sure I'm there, because she could prevent that, which is really cool. I had no idea that was even possible till that point in time. It's vitally important to get prenatal health care. It begins very early in pregnancy. I believe my doctor's office saw me first at 8 weeks. Some start earlier. And there's a focus on guidance from health professionals. But if you don't have health insurance, right, if you don't have access to care, poverty, other issues, you might not receive this care, which is really unfortunate because it's associated with higher survival rates and reduced prematurity. And this is why places like Planned Parenthood are so important. People associate Planned Parenthood only with abortions. That's actually less than 10% of what they do. The vast majority of the work they do is things like prenatal care, is things like pap smears, breast exams, things along those lines. So, in these places where these things are shut down, like Planned Parenthood or other health clinics like this, then those women don't have access to affordable care. Carter, really good question. This is also disputed. So, yes, I was told not to eat sushi, which made me really sad. You can eat the cooked sushi. So things with like the fake crab or things that are like deep fried. But my favorite is obviously the raw stuff, so that made me sad. So in the US, we're told not to eat sushi, and we're also told not to eat unpasteurized, like soft cheeses, things like brie. In other places around the world, they think that's crazy. Like in Japan, women eat sushi all through pregnancy. Now, granted, it's also possible they're getting like better caliber there, but maybe not. And then in France, I actually have a friend who travels quite a bit for work. He works for Jefferson Labs on the peninsula. And he said when he was in France, and when his wife was pregnant and was telling them, like, my wife can't eat cheeses. They're like, what do you mean she can't eat cheeses? And essentially, they said there they don't eat like greens or sprouts, because if you think about like the E. coli outbreaks we hear about, they're often from, some sort of greens or sprouts. So coffee is a really good question, Caitlin. So what I've seen from the literature and what my doctor told me is you can have like 1 small cup of coffee a day, essentially the caffeine equivalent of that. Yeah, and like people are always going to tell you everything's wrong. One of my favorite things I've ever seen is an article that said, don't sleep with your child in your room, but how dare you put them in their own room because they're going to be lonely, and, don't drink coffee, but do drink coffee because most are going to stay awake, right? So yeah, what I've seen, and this is a consistent message I've seen from like reading stuff myself and also hearing from different other people's OBs as well as mine, most people are saying you can have 1 cup of coffee per day, that equivalent of caffeine, and be fine. Again, I'm the rare academic that doesn't drink coffee, so that wasn't a problem for me, but certainly other people could. And in fact, my diet ended up being much more restrictive because of the gestational diabetes, so I had to eat 6 times a day. I had to eat like a very complicated calculus of like this much protein and this much carb and this much veggie at every meal. So yeah, I used to have to like eat while I taught. That was great. Very professional. My students all understood. Yes, co-sleeping, people debate that. People argue that you're going to roll over and crush the baby, but cultures all over the world do it, and they're still populated, right? We did sort of co-sleeping. What we had was a bassinet, and it was actually kind of cool. It kind of went like this, and so you could like swing it away to get up out of bed, and then you could swing it back, and she was right next to me. I could just roll over, put my hand on her. And so, you know, there are ways to do it safely, I guess is what I'm saying. But certainly you're going to hear it both ways again. Ariel, I think as long as you're not like me and you don't have gestational diabetes, you can totally give in to cravings. It's like a time in your life where you have a license to do that, for sure. And it's so silly because sometimes they'll tell you you're gaining too little weight. Sometimes they'll tell you you're gaining too much weight. As long as your baby is healthy, honestly, and you're healthy, it's fine. That's basically what I've seen. Like, you're not engaging in like drinking or drug use, right? And too excessively. You're not, you know, going totally off the rails. As long as you're generally taking care of yourself, you're taking care of the fetus too, or the embryo, depending on the stage you're at. Yeah, really good question. Pica. Ooh, also a good question. Okay, so pica, if people are not familiar, is technically described in the DSM as the eating of non-nutritive, non-food substances. It ironically used to just be non-nutritive substances, and then they realized that with like the expansion of diet foods, there's a lot of diet foods that are technically non-nutritive, like Diet Coke, right? So they changed it to be non-nutritive, non-food substances. Yes, so some women, when they're pregnant, will eat or have a craving to eat at least dirt and things like that. Typically, if they sort of like adjust prenatal vitamins and things like that, they can do it. But there are subcultures where eating the dirt, eating the mud is considered culturally appropriate. And you're actually not diagnosed with pica if it's part of your culture. And those babies come out fine. So, you know, I personally wouldn't want to eat dirt, but at the same time, it's probably safer to eat dirt than like a doorknob right now, right? Like dirt is cleaner than coronavirus. So, yeah, that's definitely something that like you would talk with your physician about and try to get under control. But it doesn't seem like the worst thing that can happen. Really good questions. Yes, cornstarch, chalk are very common. Again, obviously you want to watch if they become more dangerous substances. So if anyone's ever watched My Strange Addiction, about half those people actually just have pica, and they'll eat things like glass or laundry detergent. You don't want to do anything like that, obviously. Nothing that will put your life at risk, for sure. Good questions. Anyone else have questions about prenatal stuff? I obviously knew quite a bit about it, so I've been through it. Yep, eating grass, dirt, clay. I remember when I moved to Augusta, one of my friends was buying for all of her furniture on Craigslist because she had moved from California, didn't want to bring everything with her. And there was someone like asking, where can I get some of that good red clay like my grandma used to eat? Again, that was just a cultural thing, so it wasn't technically pica. But yeah, pica in general is fascinating. I saw a Grand Rounds talk about it while I was on residency, and there are people who will eat books. There are people who will eat really dangerous stuff like silverware. There's a version of trichotillomania, which is a disorder where you pull out your hair, kind of related to anxiety or impulse control. And there's a version of that where they'll eat it, and that can obviously be dangerous and back things up. So yeah, pica in general is fascinating. In terms of eating spicy things affect the baby, no. At least nothing I was told about would. Why people crave that if it's dangerous? Good question. And we think that there's probably other ways to get that nutrition, and maybe in the past we got them, right? Maybe in the past when we ate more red meat, right? We were eating mammoths or whatever. Then we got the iron that we might be craving in the ground. You know, we're not actually sure. That's a really good question. Yeah, in general of the like dangerous stuff, no idea, honestly. Like I've never treated someone with pica. It is classified under the feeding and eating disorders now, but when I was in grad school, it was in its own separate category. So I just didn't learn that much about it, honestly. So yeah, I'm not sure exactly the pathology. That would be a great thing to, Google, look into, see what some of the causes are. Good questions. Oh, good question, Carter. Yes. So no. Yes. So if anyone doesn't know the term rainbow baby, it's a baby born after your parents have had a miscarriage. No. Essentially, so I've been being more open about this. So full disclosure, I had a miscarriage before I had my current child. It's awful. It's devastating. It was early in my pregnancy. It was really hard to process. And I asked a lot of those questions, like, is this going to happen every time? And is this going to affect anything? And they told me no. Again, like, I think it's like 1 in 3 women will have a miscarriage, and 1 in 4 pregnancies will end in a miscarriage. So, it's way more common than we know. And so it doesn't affect it traditionally unless you have some sort of medical condition in the mom that's causing it. So something like endometriosis, for example, you might have come with the next pregnancy. Let's see. Ooh, Munchausen by proxy. Not that I know of, but certainly, Ariel, it's possible. So if people don't know what Munchausen by proxy is, this is a horrible, horrible syndrome where a parent or a caregiver, often the mom, but it can be whoever else is a caregiver, will somehow psychologically get reinforcement from being in the role of a parent of a sick child. And so they will purposely cause illness in their child. So they will give them things that will make them ill. If anyone's seen the movie Sixth Sense, 20-year-old spoilers, but there's a case near the end where I believe it was the mother had been mixing something into the daughter's food and she had died. And kids, it'll be big extent. Kids will go through surgeries, illnesses, things like that. And typically, the only way we can really diagnose Munchausen by proxy is by taking the kid away from the parents. And if they start getting better right away. It is considered child abuse, and you can, go to court and obviously lose custody or even face criminal charges for it. No, as far as I know, not the act either, Ariel. Yeah. Munchausen by proxy seems to have a lot to do with maybe you as a child being in a sick role. You can also do Munchausen to yourself. So it sounds weird out of contract. It's just called Munchausen syndrome, where you make yourself ill, and that's fairly similar. Oftentimes, the people who engage in the behaviors of Munchausen's or Munchausen by proxy are in the medical field themselves. So they might be a nurse, or they might be someone who just works in medical records, things along those lines. And then that will essentially give them just enough knowledge to do this stuff. Interesting. People considered unethical for women who are bipolar to have children. I've heard this with psychotic illnesses. Ariel, I was thinking that you were using a euphemism for sex, so I'm sorry. I'll have to look about that. That's possible. Carter, to go back to your question, I've heard that with people with schizophrenia. Certainly people with developmental delays, I've heard that with. No, it's not unethical, and in fact, they can be fantastic parents. The only thing that can be tricky is trying to navigate which meds you can take while you're pregnant and if you decide to breastfeed, right? And making sure you can stay, well for yourself. But yeah, people will argue this, and for years, actually up until the 1970s, actually, Carter, you would know this because we talked about this in WGS, but just to fill everybody else in. Up until the 1970s, Virginia actually had essentially a eugenics program So think about Hitler and the Nazis, same principles, where they would involuntarily sterilize, so tie their tubes, give them a hysterectomy. Women with developmental delays, women with schizophrenia, severe mental illness, etc. Obviously not ethical, obviously not cool, but it did happen, unfortunately. It's possible for egg donation that they do put on a lot of strict criteria just because of what people are going to be willing to pay for, if that makes sense. So technically, when you're an egg donor, the people who are getting your egg are paying for it, right? They're paying for the medical care. And so they want to make sure it's like really carefully screened. So they rule out a whole bunch of stuff, not just bipolar disorder. But yeah, really good questions. Yeah, we do have weird ideas about who should be and shouldn't be allowed to have kids, right? And then there are people every day who have kids who maybe shouldn't, right? But we would never say anything because they don't have a mental illness or they're from a rich white family, right? For years, this happened to Native women and women of color as well, where they were, and unfortunately, just this year, there was a whistleblower nurse at an ICE facility who reported that there was an uptick in the number of sterilizations, hysterectomies being done on women, immigrant women who are in these ICE facilities. So this idea is still going on, unfortunately. There's also a really like disturbing, I can't even think of a better word than that. It's like beyond disturbing. Case in Chesapeake. So if you look in the Virginian pilot, there was a guy who, you know, it wasn't any kind of eugenics. He basically just wanted the money from performing a lot of surgeries. He was an OBGYN and he would just like tell women they couldn't get pregnant and they needed these surgeries, and obviously very unethical, obviously really problematic. So yeah, find yourself good, trustworthy medical providers is what I have to say. If anyone needs a recommendation, please feel free like emailing me for my OBGYN practice. I love them. When you're pregnant, in my practice, you actually saw every doctor and midwife in the practice. So whoever was on call when you gave birth, you would know them, which was really cool. And they were all great. So yeah, finding that good medical care is really key. And hopefully, based on what was just announced over the weekend, we'll still have access to greater amount of good medical care, and it might even, our access might improve. So, woohoo! All right, any other questions about pregnancy before I move on? We're going to start talking about the neonatal period. Okay. So neonatal is your first month of life. And one thing I should say is these slides from here on out assume sort of full-term birth, normal development. There will be cases where I kind of touch on differences that can happen, but in general, we tend to look at sort of what we consider normal development. So just that going forward, let you know. Sensory abilities when you're born, you can respond to taste, and you already like sweeter things better. And in fact, maternal milk, particularly what you get the first few days, is sweeter. So that makes just sense. In terms of visual and auditory preferences, at this young, you already have a preference for human faces and voices. And infants can see colors and differentiate between them at 1 to 2 months. And you might be like, how do we know? We do studies with babies by looking at their focus, their eye focus. Where do they look? And they tend to look at things that they notice are different. So if you show them different colors and they look and like, right? That can kind of show, oh, they notice that there's a difference. Now, really interesting sort of possibly abnormal development, depending on how you describe people who are neuroatypical or on the autism spectrum. There is some research showing that as early as this stage, so the first month of life, there are differences in focusing on human faces in people who are on the autism spectrum. So there's another nail in the coffin for the idea that vaccines cause autism. They do. There's lots of research shooting that now. But again, this happens way before you have any vaccines. All right, in terms of social abilities, so we do have these things called mirror neurons. We have them, and the great apes have them. And they fire in response to other people's goal-directed behavior, and they motivate an immediate mirroring response. So if other people are doing things, you want to copy them, essentially. And mimicry through mirroring and other purposes helps the infant to adapt. Now, interestingly, like a lot of stuff we're talking about, this is a little controversial. Some people say mirror neurons aren't as important as we think they are, or might not be as essentially influential in development, but it certainly is a thing that we have some research about, again, not only in humans, but also in chimpanzees, things along those lines. But you're also born with some really cool innate reflex. So the postural reflex, you can sit with support when you're this young, believe it or not. We have a grasping reflex. And so this is if you put your finger out to a baby, they typically grab, right? That's a reflex. I know that we're all like, oh, it means they love us. I mean, baby, but it's also a reflex, right? The rooting reflex. So if you stroke their cheek, they'll turn their head towards it. And that is a reflex for when they're being breastfed, right? So if the breast strokes their cheek, they'll turn towards it so that they can get food. And they'll start sucking as well. The stepping reflex, if you hold a baby up, even this young, like you're not going to see, let me back up. They kick their legs up and down. Yeah, I can't get far enough back. But they basically kind of go like they're stepping, even though they're not walking on anything. Again, this is preparing them to walk later on, a year plus later on. Now, this is a really interesting thing about human babies and some other mammal babies, but if you know anything about animals when they're born, a lot of mammals are instantly able to get around, right? From, like horse babies are usually, foals are usually up within the first couple hours. Same thing with like giraffes, right? They need to be able to run away and do things right away. And so why not humans? Well, this is why. We got big old craniums. And when you give birth, actually the skull isn't fully formed. There are these plates that take a while to fuse together, so they can kind of squish to get out of the vaginal canal. But the fact that our heads are so big proportionally to our bodies is one of the reasons they think that we are so dependent. So if you look at comparable mammals, not the apes are similar to us, but things like elephants, whales, their gestation period is much longer, sometimes almost double what ours is, right? So ours is about 40 weeks, people say 9 months. Elephants might be like a year and a half, right? I'm not exactly sure, but it's somewhere around there. And they think that in theory, humans might be supposed to gestate for longer, but if they did that, we'd never be able to give birth, essentially. And so this is why human infants, ape infants, are so dependent on us for those early parts of their lives. Alrighty, so now we're going to look at locomotion and how this changes over time. So at birth, can't really do much but kind of squirm around, right? Do those reflexes we just talked about. By 1 month, they can respond to sound, and they become quiet when they pick them up. They are immediately calmed, often, especially if it's the parent. Otherwise, occasionally, they make noises that are adorable. They're sort of, by 2 months, they can smile. They recognize their mom. They recognize their other caregivers. They will acknowledge them with a smile where they might not acknowledge a stranger. They start to learn to roll. And this, again, will vary from baby to baby. It's really funny. We had the Mayo Clinic's development, first year of life book. And I don't know how many times it said, every baby's different. If your baby doesn't do this at this time, you'll be fine, right? So this might take till 3 months or 4 months, and that's fine. And they can start to lift their head, right, and not have to always have the back of their head supported. They start to respond to an adult. You know, again, they're clearly not making words, but they're getting that conversation is a thing. They'll search for sources of sound, kind of look around to try to find where's that coming from. And they start to sit better with support. Again, their head is steady. So you can kind of like pop them up. I think we do have a picture of Quinn with a bunch of our friends' daughters at that age where she's kind of like propped up on the couch. Everyone else was old enough to sit up by themselves. So at 4 months, they can follow toys and they'll sit with less support. At 5 months, they can start to discriminate strangers from familiar people and start to get that stranger danger. They can start turning from their back to their side, maybe even working their way around to their belly. And they make distinctive vocalizations. 6 months, they'll start picking stuff up and banging it. They smile at their image in the mirror. Interestingly, typically we expect kids not to recognize it's them in the mirror, so they're maybe around 2. For some reason, my daughter got this pretty early on. I think she was before 1, maybe 7 or 8 months when she got it, but that's really atypical. Typically, you don't see this until they're 2 or 3. They'll also start to reach for objects, and this is why you have to like baby proof your whole house, right? So Kristen to say she has a 5 months and yet yelling and banging toys everywhere. Yep, smiling and laughing in the mirror. It's one of their favorite toys, right? Because they don't know who that person is, but they sure are funny, right? So this is why a lot of baby toys will have a mirror on one part of it. Yeah, in 7 months they'll start to like make more playful responses. They'll sit alone. They might start crawling. I think Quinn did start scooting or crawling backwards at this point. She cracked me up. She would like get herself stuck under things, especially the backers. They vocalize up to 4 different syllables by 8 months, and they listen to familiar words. They will surely recognize their name by this point. They start pulling themselves up, again, making sure the whole house is baby-proof. And there's still stuff going on at 9 months, just this particular table doesn't include it. They might play pat a cake. By 11, they might start to stand alone, kind of in between here. I guess probably more the 9 month stage. They do what they call cruising, where they like hang on to a table and kind of sidestep down it. And then somewhere around a year. And again, this will vary. I have a friend who has a kid who walked at 9 months. I know other people whose kiddos didn't walk till 18 months. But somewhere in that range, they'll start walking. And then here is sort of the same thing, but puts all on one slide if that's easier for you to digest. And you know what? I think I'm going to stop there today because I actually have to do something developmental for my kiddo today. I get to go to my first ever parent-teacher conference. She's 2, so, you know, not going to be too much. She got good marks on sharing, so that's good. But I will stick around in a couple minutes if anyone does have any questions. And in case you're wondering, the Explain It to the Media quiz will be a week from Wednesday. So I'm going to do it after we've covered all the information. So everybody have a good day, and I'll see y'all on Wednesday.